Hey, Ben.
Hey, Mark.
How's
Sorry,
it
I was
going?
on mute.
Yeah, no problem. We still have like a couple of minutes before we start.
Cool.
All right, so welcome to our webinar on Muscadine Pick-your-own operations during the COVID-19 year in North Carolina. My name is Mark Hoffman. I am the Small Foods Extension Specialist at NC State, and I'm the host today. And Debbie Wexler from the Muscadine Grape Association is the organizer of this event. We have several panelists today. Dr. Chip Simmons is an area-wide specialist on the food safety team of NC State, and as well as Ben Chapman. He's a professor and extension specialist and also a food safety specialist at NC State University. Also myself, I will give a small talk on COVID-19 and pick-your-own operations, and then we have several growers who will give their expertise how they did handle pick-your-own operations earlier this year. So first we will talk about general information on COVID-19, and we'll open it up for questions there on your pick-your-own operations. That will be led by Ben Chapman and Chip Simmons, and then we will dive into Muscadine Pick-your-own and COVID-19 and safe operations. And after that, we will give an example of a safe operation in a strawberry farm earlier this year. Karam Lee, a grower in Apex, North Carolina, has agreed to be on the call today, and then we will open it up for questions and answers. And I see that we have some questions in the chat box already. So yes, at the moment you are muted, and you can put in your questions either in the Q&A button or in the chat box. But we will be opening it up later for everybody to talk in the Q&A session. However, please tell us if you want to talk in the chat box so that we can unmute you and you can ask your question. Please write during the talk all your questions into the chat box. We monitor the chat boxes, and we will try to address all questions during and after a presentation. If we have enough time, again, we can mute yourself, and then our dean is on the call and raise the hand. So I would like to give the dean the opportunity to talk. I guess that's why he raised the hand. Let me see where he is. There he is. So Mr. Richards, you should be able to talk. You just have to unmute yourself.
Yeah, okay. Unmute.
Yep.
Can you hear me?
Yes, sir.
Mark. Yeah. I raised my hand by mistake.
Oh, okay. All right.
So,
No problem. All right, thank you. I'm gonna mute you again. Thanks.
okay, moving back. All right, thank you.
Thank you. So this is how it works. So later in the season, everybody will have the opportunity to be to ask a question. If you have questions in between, please put them into the chat box, and we are going to address them during the talks. That is pretty much it in terms of rules and agenda. So I will we'll stop sharing my screen, and we'll give it to Chip and Ben for the first talk.
Okay, did that pop up, Mark?
Yep.
Yes, we can see it.
Cool. So really appreciate you guys having us here today. They asked Ben and I to come kind of give some general background about COVID, about transmission and things like that. And we wanted to allow a few minutes at the end of our portion just to try to answer any questions that folks might have. And Ben and I will kind of trade off back and forth through this series of questions. So one of the first questions, what we know about COVID-19 transmission. Really, it's a respiratory virus. All indications are that it's not associated with food, and the site of attachment really are the lungs. So you have to breathe the virus in, and it has to come in contact with those cells to cause transmission. You want to take this next one, Ben? COVID-19 on food surfaces and containers?
Yeah, absolutely, Chip. Thanks. And thanks everybody. Thanks to Debbie and Mark for inviting us today and to let us get in front of you and answer any questions that you might have. When it comes to COVID-19 on food and surfaces and containers, I want to highlight something here is that when we're talking about COVID-19, that's the illness that's caused by a virus called SARS-CoV-2. And the virus itself, we actually don't have a whole lot of data on virus persistence on food surfaces or containers when it comes to infective viruses. What we have seen over the last 5 or 6 months, and if actually we go back in history and look at SARS-CoV-1, which was another respiratory virus that led to illnesses in the early 2000s, we have seen some studies where we can recover the genetic material that's inside the virus, it's RNA, viral RNA, over time. But what we don't really have, and as Chip said, we don't have any evidence or really any indication that infective viruses remain on food or on surfaces or on containers for very long. And I guess very long, let me define that a little bit. Probably our best guess is looking at the most, maybe a day under the ideal conditions, but in many other situations, we're looking at less than a couple of hours, or maybe in the minutes. So one thing I do want to highlight with this is you will see and you will hear over the next 8 months or a year of multiple times where people are, quote, testing food for COVID. And in fact, we've seen a few examples of this recently, specifically in China. And last week there was a report of frozen chicken wings with COVID, and I'm using air quotes because it's not really COVID. What was found was this viral RNA, and it's not surprising whatsoever that we find it there, but the risk of transmission through food or from food even to our respiratory tract has really not been demonstrated at all. And I say there's never zero risk, but we're talking like 1 in a billion chances here, not 1 in 10 of it. So yes, it can, the SARS-CoV-2 virus can be there, but it's not. In fact, we have very few in the published literature examples of surfaces directly transmitting, being the vehicle to transmit the virus. It is, as Chip said, almost solely person-to-person transmission from a respiratory setting.
So if I could, Ben, one of the things that I'd like to jump in, I'm sure all of you guys have gone through some type of food safety training, and we always go back and forth and talk about viruses and foods and the fact that they are really hardy in the environment, and the fact that hand washing is really a key. And for this particular virus, there are 2 major types of viruses. There are viruses that are enveloped viruses and then non-enveloped viruses. And the ones that we think about for food transmission generally are the non-enveloped viruses like hepatitis A or noroviruses or things like that. And those, again, are really, really hardy. For this particular virus, because it's an enveloped virus and a respiratory virus, it's not nearly as hardy. Like Ben said, we might be looking at hours to maybe days that this might survive. And because of that, it's extremely susceptible to hand sanitizers that have 60% or more alcohol in them. So that's really kind of the difference in what you hear all the time about hand washing and don't use hand sanitizers versus this particular virus in this unique case. So far as control of COVID-19 and pick-your-own operations, certainly because it's a respiratory virus, because it's spread person to person, like Ben said, and it's mainly droplet associated, it's extremely important that your patrons, that your employees wear masks. Again, it's important, don't throw hand washing out. Certainly hand washing is effective. And it's thought that even the soap that you use with hand washing would help break down the virus. Hand sanitizers have proven to be pretty effective. And then social distancing. So a lot of the things that we think of, that we hear about on TV, that we hear about kind of in our normal day-to-day routine, are the same concepts that we would suggest for the pick-your-own operations. Anything to add in, Ben?
No, I guess the only thing I want to just put a point on for Chip's point here on this mask, face covering, wearing. There's been, obviously it's a hot button issue, and there's been a lot of like conflicting data about wearing face coverings outside versus inside and the importance. And one thing that is this is for, think about all of our careers, but from science standpoint, Mark and Chip and I, we have not been faced with like emerging information with a real focus quite like this before. And every day there are somewhere in between 50 and 200 papers published on SARS-CoV-2. And that, like, our decisions on mask wearing outside versus inside is based on really limited data right now. And so from a best practice standpoint, even though we know these are outside environments, having those face coverings in the outside, we believe is still more protective than not wearing it. And so don't get caught into the sort of daily grind of the updates in this area, that it is still very much best practice for staff and for patrons in any time that they're interacting with each other, to be wearing these face coverings. And I'll move into the next bullet here on safety of staff and pickers, including family. It's really the biggest risk we have in this outbreak is being around other people, especially around other people who are not in our family. And there is CDC, Center for Disease Control, talks about close contact, and they've put some parameters on close contact. They talk about 15 minutes within 6 feet of an individual. And that's, again, based on our best available information. Is 7 feet better than 6 feet? Absolutely. Is 12 feet better than 7 feet? Absolutely. There is nothing sort of magic about these distances. It's just the threshold that CDC is really comfortable with right now. And I'm not saying that it's wrong or it's right. In fact, I very much support that based on the data that we currently have. But the more that we can be away from people for longer amounts of time, the less likely there is for transmission. And so that's really about thinking, how do you distance your staff? How do you distance your staff from patrons? We've seen in the food world a lot of no contact delivery, same thing, no contact conversations. Excuse me, and being away from people is really, really important. Chip, back to you.
Yeah, great point, Ben. And like Ben said, it kind of gets into what Ben was saying with the distances. Also, kind of follow suit with the time that you're there. So, if it's a brief interaction that you're within 6 foot, certainly there's less chance of exposure to the virus than it would be if you're there talking for 20 minutes or something like that. So it's all about the time and the risk level. One of the other points to make, kind of within all this, is that we know now that this is transmissible even if you're not showing symptoms. So for folks that are not showing symptoms, it's shown that once you're exposed, once the infection begins, you cannot be showing symptoms and actually be able to spread this 2 to 14 days before symptoms actually pop up. A lot has been done, like Ben said. I mean, there are just multitudes of papers that are coming out now, but a lot has revolved around testing, a lot of questions around testing, and again, that's another kind of another hot topic right now, how accurate the tests are, and when the test would be positive and things like that. Until now, they've used nasopharynx type swabs to get samples, as well as blood tests. There have been several papers that have come out, maybe in the last week or so, showing some promise of saliva-based tests. So all of those are ways that folks could be tested for this. anything to add, Ben, on the testing?
No, and I guess I can jump in on what if staff or workers test positive, or even something we don't have on the list here of what if a patron of your pick your own reports that they were positive after they visited. Really, right now, what our best guidance from CDC is, if someone tests positive, that there is a process working with the health department to bring them back into society. And there's I don't want to go through a whole bunch of different options, but there's a test-based process that includes some timing plus 2 negative tests. There's a symptom-based process, which is 10 days following their first symptom and after symptoms have subsided. And there's a combination of those. But more, I guess, importantly, from a business standpoint is, what if one employee tests positive? What happens to everyone else who is there? And our guidance right now from CDC is that those individuals who have been in close contact, meaning within 6 feet for more than 15 minutes cumulatively, within 2 days of symptoms showing up prior to, as Chip said, that those individuals would go into a self-quarantine for 14 days. And I see, as I've worked with the food industry on this substantially over the last 6 months, 5 months, that's really where we have the most challenging task, is how do we keep our employees separate? Because once one is positive, we lose our entire crew if we're not thinking about that up front and making changes on how we're handling things. And so the other thing about patrons aspect, and this has come from our experience at other farms as well, as long as those individuals were not in close contact with staff, and so if you're practicing social distancing, you're making sure that we're following all these recommendations that we've talked about, it really doesn't result in any enhanced risk for employees, resulting in closing down, which is a little different from where we were approaching things back in March, where if a restaurant had a patron who had tested positive, we saw restaurants closing down, cleaning and disinfecting. Now we know much more about the transmission risks, where this close contact is really the factor. So as long as that you are practicing not close contact, that patron really isn't impacting your business, business standpoint.
Did you want to say anything about the regulations or requirements, Ben?
I mean, I guess I can touch on this really quickly. So, and then we can move to question, or I guess we have a couple more slides here, but on the regulations and requirements, really the regulations and requirements all come from the executive orders right now from the governor on COVID-19. And so some of the most common ones are, we've talked about face masks, mask wearing, face coverings, that requirement across our state, being inside or outside as if you're around people, except for exemptions for medical reasons, as well as for exercise. And so in a pick your own situation, I would expect that the requirement really is that everyone who is there is wearing one of these if they're interacting with the public whatsoever. We actually don't have many, well, I mean, there are capacity requirements, but they're not really particularly pertinent to pick your own operations unless there was a market stand there from a retail standpoint, where the fire code capacity of that market stand would be reduced to 50% currently. But there are a whole bunch of really best practices, and we'll share some resources on that. But the requirements statewide are really just related to the two things that I mentioned for the most part. But in certain cases, and we've seen this across the course of this pandemic, there are local ordinances that may also impact your business. In fact, farmers markets adjacent to pick your own, but in certain places still in our state, farmers markets are not allowed to operate, where in other jurisdictions they are, because of congregation of people. And so I would highlight that looking at your local health department's requirements will supersede the governor's orders on restrictions, but the governor's orders are really about capacity and face coverings.
So we do have a question in the chat box, and the question is, should pick-your-own guests also be required to wear masks?
Yes. Next question.
Yes.
Yeah. Yeah, and I mean, yes, for a variety of reasons. One, it would fall under the executive order, and in fact, the way that my understanding is that it would be the pick-your-own is a public business, a retail setting that would need to follow and heed that executive order. That's a requirement, but from the risk reduction standpoint, there is striking data that shows the importance of all people who are interacting with each other wearing masks that will reduce risk of transmission. So yeah, quick answer is yes. Longer answer is yes with caveats.
There was a farm up in Virginia during strawberry season that was the only farm sort of in their area where there were a lot of strawberry farms that required masks. And of course, this is earlier in the year, but they found that customers thought they were making an extra effort to keep them safe. And so the fact that they were requiring masks encouraged people to come there. They saw it as an added benefit that this farm was stricter about the rules and that it would be safer to go there. So they found it as a marketing tool as well as an increased safety tool.
Yeah, absolutely, Debbie. I think that's a really, really good point. And I just saw another question from Wilbur Johnson that I can handle that too, Mark. And the question is, do we know the time span from exposure to infection? So again, this is evolving a little bit. And this is sort of where the calculation of a 14-day quarantine comes into play. So what we understand with the cases that we've seen now that we can trace and have seen sort of clusters leading to illnesses is that it's not so much the time from exposure to infection, but it's the time from exposure to symptom. And that is 95% of cases will have symptoms develop within 10 days. To get us to 99%, that's where 14 days comes into play. It is likely, and again, this is all evolving, that for these asymptomatic carriers, as Chip mentioned, that someone who is exposed that never develops symptoms might be infected within and is producing the virus and is spreading as an asymptomatic carrier within 2 to 4 days, but it takes time for symptoms to present. So that's that. Again, it's as quick as 2 days from exposure to infection and shedding the virus, but it could be as long as 14 days. That's the challenge. Like literally, if we could nail down that timeline and it was closer, we could really do a lot better in separating individuals. And I think there would be a lot higher compliance with the self-quarantine process from exposure that would really limit the impacts of the pandemic. But this is a virus that we're still learning a lot about.
Right.
Right. We have one raised hand, so I think we have still like 2 minutes or so. So I will let Carla allowed to talk, if that's okay with you guys.
Oh yeah, absolutely.
Sure.
We're here for you for the question, so absolutely.
All right, Carla, you're on the spot. You have to unmute. You have to unmute yourself, Carla. Maybe I can do that from here. Yep, there you go. Carla, you can ask your question.
Karma.
It's not me.
No, it's Carla.
Yeah.
All right, maybe that was a mistake.
Okay.
All right. Carla, if you have a question, and you can also type it into the text box on the Q&A box.
We have another question coming in from Deborah Blanton. So the question is, does blood type of individuals play any kind of role in becoming infected? Really, right now, there's not enough information to say that. Early on, there had been some indications about certain blood types being more susceptible, but more susceptible doesn't mean absolute you cannot get it. And I think we'll learn more about this. And I'll just, Chip, Chip has been around the world of viruses, quite some time. I've been around the world of food safety for about 20 years. It takes us years to understand that question, and we still just discovered this virus 8 months ago, and just saw the first genetic picture from a sequence of this virus 6 months ago. And so right now, Deborah, we don't know. There may be some indication of that, but certainly not enough evidence for us to really start making recommendations based on it. But an excellent question.
It's one of the interesting things, and I know we're kind of running out of time, but one of the interesting things about this, the SARS viruses that we've seen before have tended to be non-systemic. So whenever they infect, they kind of stay in one place in the lungs. And this one's quite different in the fact that it may show up other places, it may do damage other places. And it actually has gone so far as to, folks have noticed that there's viral shedding in fecal matter. So it's been showing up in at wastewater treatment plants and things like that. So this is very, very, very different. We know what the symptoms are. We know what the short-term effects are. The thing that scares me is what those long-term effects might be from this, and what other organs it might impact other than just the lungs. We really quickly, let me see if I can make this move forward. We'll get the slides to Mark, and he can post those. We were going to put a plug in for this. This is a brand new publication from FDA, came out just within the last few days. Employee Health and Food Safety Checklist for Human and Animal Food Operations. And it gave a little diagram here. We've talked about social distancing, but certainly something to keep in mind at a UPIC operation as you direct people and where they might pick. And then I just wanted to give Ben a chance to put a plug in for some of the resources, because his group has been really fantastic at developing a lot of these resources for across all food sectors.
Yeah, so I'm scrambling to put a link into the chat box for everybody, but as Chip mentioned, we developed and continue to develop resources specific to food safety and COVID-19, handling guidance for UPIC farms, farm stand operators, farmers markets, all the way through to meat and poultry processing plants. So there's about 160 different resources that are posted at the link that I just put in the chat box. And it is something that we continue to add to. We'll be doing more of this over the next couple of years as well. So, now that we've connected, either through Debbie or Mark or Chip and I, if you have questions or need other resources developed on behalf of the sector, please let us know, and we'd be happy to do that. But this is an area that continues to evolve, but we are really focused on getting as much information to the industry as possible.
And we'll share with all people who've signed up with this, whatever, sort of package together, whatever resources that we can, and send it out to everybody who's signed up for this webinar.
Great, thank you, Debbie.
Yeah, so we have a bunch of different questions here. I'm just going to go first to those in the Q&A box. So Carla has asked, what's your recommendation for sanitizing buckets to facilitate quick reuse? Our buckets are double lined with plastic bags that never have been used before. And I think Karma can talk about this also a little bit, but I'll just give it to Ben first.
Yeah, this is a good question. It's probably one of the biggest challenges that we have in the pick-your-own setting. So the difference between the sanitizing that we do normally for food safety and disinfection that we're doing for SARS-CoV-2 it's different. One thing that I will highlight, and we link to this on the page that I just mentioned, is that there is the first thing I would do is check to see whatever compound I'm using as a disinfectant is listed by EPA to be effective against SARS-CoV-2. There's a list on that website, and maybe after I answer this question, I'll throw it into the chat box for everyone as well. But it's called List N, and it truthfully daily gets updated with more compounds. But I want to make sure that what I'm using absolutely is effective against SARS-CoV-2. Very briefly, alcohol-based disinfectants, most are. Quaternary-based disinfectants, some are. Bleach-based disinfectants, most are. The most important part about that is contact time. So what I might normally do in my quaternary ammonia sanitizing is dunking, cleaning and then dunking for sanitizing. And now I need to actually really think about spraying and letting it sit to air dry. But the contact time is really the factor for this virus, which is different than how we've handled things in the past. So, Mark, to the question, I guess it's to Carla's question. One concern that I would have is how plastic wrapped bins or picking boxes that plastic may degrade with this contact time and the disinfectants, and how we need to think about some other strategies. And really, the inside plastic that touches the fruit doesn't matter. It's I'm disinfecting handles. I'm disinfecting those high touch surfaces that other patrons or staff members may have touched. But that's where I'd really focus. Chip, anything to add?
Yeah, I would just to kind of go along with that. You mentioned contact time. So in some cases, you would actually use a higher concentration for disinfection versus sanitation. And like Ben said, it comes down to the concentration of the disinfectant plus the contact time, the length of time that it's exposed. But again, this isn't, to our knowledge at this point, this isn't a food issue. It's a person-to-person issue. So even if it's on food, if it were viable and it were swallowed, it's not going to make it past the pH in the stomach. It has to get, into the lungs. So it's really, like Ben was saying, it's a person-to-person thing more so than being a foodborne thing.
All right.
Sorry that we've gone over, Mark.
Yeah, no problem. I just would like to give karma because I know that there are a couple of other options for people who use buckets and pick your own operations. Yeah. And one of the options is to basically sell the buckets with the fruit. And I believe, Karma, that's what you guys did. Is that true?
Right, that's all we did. In years past, we would let people pick in our buckets. We would take the buckets back and then we would wash and sanitize them and reuse them again the next day. But this year, when we supplied all the picking containers to every customer, and once they purchased the container with the strawberries, that bucket was theirs to take home. We didn't want it back and we would not take it back. So they bought the container and paid for the container and the strawberries all at one price. They picked in it, they took it home, the bucket was theirs. Now, if they wanted to come back and bring it back and use the same container to pick in on their next visit, they could do that. We just knocked $1 off the price because they'd already purchased the container, but we did not want any of those containers back once the customers had touched them. It just worked out better for us. We weren't exposing ourselves to stuff that everybody else had been touching, and it was a huge time saver, and I think that's what we're just going to continue to do from now on.
I mean, I love that strategy, Karma. I think that's a real smart pivot in how you are approaching your business, and it absolutely eliminates this entire discussion about how are we going to disinfect them. One thing that just to jump off of that a little bit, especially early on in this pandemic, there were hesitation about reusable grocery store bags and reusable picking baskets, but the risk, just as you described, if the only person who's handling that are the patrons and they're not transferring it, that strategy, I would absolutely support those individuals coming back with their own buckets that they purchased from you for repeated use. I think that the risk is like negligible, close to zero of that. So yeah, I think that's a really great strategy.
And that evolves, that eliminates a lot of operational, headache if you want to sanitize all your buckets all the time, every day. That's, yeah. All right, so we have two more questions here, and they come from Deborah Planton. She asked if individuals can enhance their immune system with like vitamins or other things. I believe that's one, because there are two questions, but we can answer that in one question. So.
Sure. And similar to the mask question, the answer is no. Currently, based on this, what we know about this virus, everyone is susceptible to infection. There are higher risk individuals for developing more serious symptoms that we've talked about from the start of this pandemic. Really, anybody with an underlying health condition, and with our aging population, the elderly. But we've seen a very striking switch in our public discussion of, well, we didn't think kids below the age of like 12 could get infected. Well, in fact, if we look at data nationally since the last week of July, that's the growth rate of infections are in kids in between the age of 2 and 12. So there is not, we don't have any understanding of anything protective, vitamins, certain attributes, consuming anything to really provide protection from infection. And likewise, we don't even have good data on acquired immunity for people becoming reinfected. In fact, in certain cases, we thought that there was a chance that there was some immunity that stayed for a while, but then we have other examples of multiple infections for individuals over the last 6 months. So this is all evolving, but as of right now, I think it's really difficult to point to any protective consumption of anything protective, doing anything protective. We are all susceptible to this virus.
All right. So thanks. So if you guys have still more questions, please put them into the text box or into the Q&A box, or raise your hands. We will monitor that over the next 30 minutes of this webinar as well. For now, I would like to share my screen. And can everybody see that?
Yep.
Okay, good, great. So then we just go talk a little bit. We talked about a lot of this already, and so we'll go quick over this. We have some data from earlier on, because this pandemic started in March, and we do have some data on how it affected Pick-your-own and food businesses and with direct to consumer market strategies here in North Carolina. We did surveys in April and then another in July, which we are at the moment are still analyzing. And I'm going to talk a little bit about that, what we saw, what happened to businesses in the past. That doesn't mean that that will happen again, because again, it changes over time. Economic situation changes over time, but at least it gives us a little bit data which we can play with. And then after that, we'll talk about the common safety measures which we saw in other pick-your-own operations, but also what we heard from growers who want to implement that in their Muscadine Pick-your-own operations. And then I will give an example of how it could look like. And after that, we will open it up for questions, and Karma will share her story of her strawberry patch back in April and May. So what we saw in general in the past were what we saw that the sales were up, especially in the beginning of April and beginning of 2020, April and May. And we had many new and first-time customers in our Pick-your-own operations. And we think that's mostly due because a lot of people stayed at home. So those stay-at-home orders are not there anymore. So that might change. I heard a lot of people saying that, oh, we had such a great year this year, so we're going to increase our acreage or something next year. I would not count on that. Also, we saw a lot of more curbside pickup, pay in advance options, and online ordering and pre-ordering. That was done much more, and Karma will talk about this a little bit later too. And we had a little bit less traffic on farmers markets as well, but that also has changed because the farmers markets had to like adjust to the new situation as well. So what we can expect, it will cost more if you implement those changes. You will have to buy equipment, you will have to be there. So that will increase costs. If you're lucky, you will have more customers. And as Debbie said before, in a lot of places, if you implement those safety measures, your customers will come back because they feel safe at your pick-your-own operation. So that will drive customers to your place as well in most regions. And you will get a lot more questions from your customers as well. So be prepared to have some sort of answers. We had all kinds of questions from, you know, how do I clean my food that it will not transfer COVID? I hope we don't get those questions anymore, but I know in the beginning we had a lot of that. And two like very reasonable questions: when do I wear a mask, and how do I have to be safe, stay safe to my peers and to other customers who are not part of my family. So you will get a lot of those questions. The best thing is to be a little bit prepared to those. And that is the resources which the food safety team and Ben are developing. Those are very, very helpful to have those kind of answers on your hand. So you really should look at those and have some of those either printed out, or you can hand them out, or like memorize them and you can talk to your customers. But that's very important too. So I don't want to go too much into detail here. We did a big survey across all specialty crops in North Carolina, and these are only the berry crops. But what we see here is that the blue bars are if somebody had to close their business, and the red bars is if they had less traffic than usual, and then the purple bar is if they had more traffic than usual. And as you can see here, what stands out really is that farm stands, so curbside pickups or anything where you can actually buy the fruit, and U-Pick operations there were many of them who had more traffic than they had in the year before, while most of the other things, with the exception of online, we had a lot of new online people who started online businesses. I think, Karma, you were one of those who started an online business. And so we had a lot of that picking up, while most of the other parts like restaurants or wholesale, they basically either stayed the same or had reduced traffic in April and May. And again, this might change now because as the pandemic moves forward and the economic situation changes, but those are at least the data we have so far. So common safety measures, pay in advance, pre-order by phone or online, or pickup services. That's very common. A lot of our operations have done that in the past. It is a little bit more work, but it keeps everybody safe because you don't have that one interaction with your customer anymore. They're already sold. They can take their buckets and just go to the field and pick what they have paid for. Usually what that means is you would have to pay by bucket. So you can do a 4-ounce or a 6-ounce bucket, and you give it basically a set price. And then usually what happens is that the people make those buckets really full. And but you don't have that interaction with your customer, and you might attract more customers. So at the end of the day, you might come out on the top of that. But that's one option to do. Signs are very important. Have signage on your farm, how to keep distance, and also if you do credit cards or cash exchanges, try to have like distance between your customers and yourself. Wear face masks. Have your customers wear face masks. And some also asked that the customers have exact change so they don't interact with them and giving them basically change to cash. So those are all very common things which people implement. From the customer side, require face masks. We talked about this. 6 feet distance in the field, again, is something which I would recommend. Have small groups. The best thing would be families picking together, and then have between those families, try to keep the distance between those families. And also, if symptoms are displayed, some farmers do refuse or keep the option to refuse the entry to the field. Again, that also requires that you monitor that. So, and most people don't let them eat or stay in the vineyard. So they basically pick and go home. So we don't. So those activities are usually very reduced in our pick-your-own operations. So I took some of Karma's pictures just to let you just to let you see how that looks like. So they had those are some face masks which the staff had, and we had signage on at the field entry, and also here, if you're basically, this says if you're sick or somebody in your household was sick, then please do not visit the farm. So those kind of signs make a lot of sense. Common safety measures for an operation, and I will show you what I mean about this, but really important is that you have like a certain flow of your customers. So don't have, where it gets tricky is if some people just stop in the field and start filling their bucket, and then you have another group going to the same wine or to the same area and doing the same thing. So you want to have so we're going to have like some sort of a flow of your customer through the field. And the best thing is have it into one direction if possible. If the field can do that, then that is probably the best thing to do, to have like groups going through the field in one direction. We also recommend to have separate waiting areas in front of the field if you have a lot of customers and you probably don't want to let them go into the field right away. It really, again, depends a lot on the size of your vineyard. But we recommend to have like 2 or 3 waiting areas where they can be separated a little bit in the groups. Also important, have your rows mowed so that people can actually walk in your rows. I'll show you a picture of that in a second, but that's also very important. If you do have if you do have not a lot of canopy on your vines, which I don't think is the case this year, but just in case you do not have a lot of canopy on your vines and people can easily move under the high wire into the next row, you want to probably skip a row or mark rows so that you have like people going into like every other row. You know, you could mark it with one color, and then with the next color you have people going into the alternative row. You have to make sure that people try to stay in one row if they pick the grapes. And also very important, provide sanitation, and all of your staff, or you and yourself and everybody in your family, should wear definitely face masks as well as your customers. Again, some pictures. These are plexiglass. This is like a pay station. Here you can see here the buckets, which in this case customers have bought. So they brought those buckets. They bought those buckets and took them back home. And this is a plexiglass stand in case somebody wants to pay or didn't do a pre-order, that they can pay at this stand here. And then these are no-touch hand sanitizers, so people don't touch them, and they and it's a soap box, and they basically provide sanitation in the field. And this is what I mean with this is a blueberry and this is a blackberry field, but this is what I mean with mow the rows. Make sure that your customers can walk those rows so that they don't have to go and skip under and go to another side of row where they might encounter other customers. So that's also a very important piece. So here's what I think it should look like if you have the space. So those arrows are like a little bit, you need to think. So that doesn't mean that you have to do it this way. This is just like an option. Or what is important is that you have a certain flow of people lined up. So those arrows basically here, they show you where people enter the field from this side, but they should exit the field from the other side, if possible, if you have that space. And then can go on the other side around. You should have enough hand sanitizer for people, or soap stations for people to wash their hands before they enter the field, and maybe if they exit the field as well. And then also what we recommend is to have small group waiting areas if you have a lot of customers, so that they have space and they don't feel like they're getting too close to each other. I would separate if you have big families, they can stick together. I would not separate, like I would not put like groups together if they're not somehow coming to the field together as a group. And then if you have enough space, pickup stations could be a little located somewhere else than your prepay and your bucket stations, basically. And then also a other option is to mark your rows if you're afraid that customers will skip rows and they will jump. So you could mark rows with like one color and then the other rows with another color. And that way you could say you go into a red row and then you go into the yellow row in our case here. But so those are also options which some growers have implemented, and I think depending on your vineyard, it makes sense to implement those in the Muscadine operation as well. I think we have a question or something. Let me see what it says. Where's my chat box? Can somebody read the question? I don't find my chat box right now. Debbie, can you read the question?
I think that's a question for later.
Okay, all right. And then again, as I said, the flow of people is very important. Try to avoid congregations or people moving from one row to another if you can. And that is especially important if you have areas with cultivars which you know they are more popular or higher in demand. And so you want to make sure that in those areas, you don't want to put too many people into the same area. And then every customer should at least has a mask with them. And in the best case scenario, they also should wear the mask, as Ben said. And yeah, so also like in another regard, you find all our webinars and all the presentations and everything on our Grape portal. And you find also a lot of other news on our Grape portal as well. So this webinar will also be online latest by tomorrow morning. And we also have a new production guide out that was a collaborative effort. I just wanted to promote that here. And then that is pretty much it from my side. So we take questions now. So we do not have a list of established U-Pick operations because we did this survey, and we do all our surveys anonymous, so we don't know who those operations are. But if you send me an email, I can link you with like 2 or 3 growers who I know had that situation. And I think I sent you my email address before in the chat box, so that would be great. I definitely can hook you up with some other people.
Mark, do you have Andy Siemens' website picture that I sent you earlier? Do you happen to have that somewhere in your? No. I was just going to say, if you have a website, it's a really good idea to put the information about what your practices are on your website, so that people who are thinking of coming to your farm to pick will know in advance how you're handling it, and can also get a feel of how conscientious you are being in managing this.
Yep. So Karma, do you want to start?
Sure. You ready?
I am ready.
Okay, so for our field, we're a pick-your-own strawberry farm, and so in April and May is when we were implementing these things. The measures that we implemented, they were simple, they were easy to set up, inexpensive but effective. Before we ever opened, we canceled all our school field trips and company picnics. We took down all of our photo op boards. We took away all the benches, all the chairs, all the picnic tables. We wanted people to come, but we did not want to encourage them to stay and hang out. So we added touchless soap dispensers like being shown. We put them inside new bluebird houses and then put a zip tie across the front to keep them in place. Then if we had to refill them, we just cut the zip tie, refill them, and put the zip tie back in. This kept them from falling out or walking away. Then we also went from having 1 hand washing station to having 6 hand washing stations. These were very simple setup with a 6-foot hose from Home Depot to connect from one to another. The 6-foot hose was ideal because that kept people 6 feet apart while they were washing their hands. We posted signage around the farm to encourage hand washing and social distancing. In April and May, face masks were not mandatory, but I would add that to our signs if we were open now. We moved out of our indoor store, which was, it was so cute, but we moved out of that, and then we set up all of our sales from under our outdoor lean-to. We put up the plexiglass barrier all the way around the lean-to as a barrier between ourselves and customers. And anytime we went through the gate and went to the outside of the plexiglass, then we put on our face mask and then used hand sanitizer before we went back in. So then I think the next slide's Mark. Nope, okay, never mind. All right, so the biggest change we made this year due to the COVID-19 was to set up an online store. We linked it to our website and our Facebook page. Our online store is set up through Square, which is our credit card company that we use. And we learned how to set that up through Debbie Roos. She's the extension agent from Chatham County. And she did a Zoom webinar to show and walk you through how easy that was to set up. So through our online store, people who wanted to pick their own can sign up for a time slot. They would prepay by credit card for their bucket or quart basket picking containers. So when they paid $14 for a bucket and they paid $5 for a quart. So everything was prepaid for ahead of time. On arrival to the farm, they would go to a hand washing station, wash their hands. We hand them their container. They went to pick and go home. And it was just that easy. There was no money exchange, no weighing strawberries, and no second interactions necessary. We would limit how many buckets and quarts could be purchased during each time slot, which would effectively limit how many families were on the farm at any given time. People really appreciating getting here and seeing that we were not overly crowded. But we would also set the number of buckets and quart baskets low enough so that we could still accommodate walk-ins, because not everybody knew that we had the online store option. Also on our online store, we sold pre-picked strawberries, our jams, honey, any produce that we had. It could be ordered and prepaid by credit card. So when we set up this online store for pre-picks, then that led to setting up a new drive-through. We would have never set up a drive-through if it had not been for the pandemic. The drive-through was a huge success. Customers came into the farm, they simply drove around our stand, they stopped at the lean-to, they opened their trunk, we put on our face mask, we put their order in the trunk, and they drove away. It was just that easy. So all it took was some bright orange cones and a few directional signs, and ta-da, we had a drive-through. It was wonderful. We'll keep doing it for as long as we keep the farm going. For customers that walk-in customers, we did accept cash and checks, but we did encourage credit card use. We got a new chip card reader, and that made taking credit cards very easy. That was probably our biggest expense, was buying the chip card reader, because before we just had a little square attached to our phone or to an iPad, and that was kind of a hassle because we would have to slide every card from each customer and hand it back to them. So the chip reader was almost a touchless type of thing. We did provide all the picking containers this year, like I said earlier. We'd never done that before. We just reused containers all the time. But once a customer purchased a container, it was theirs to take home. They could bring it back on another visit and reuse it again. We just knock $1 off the price because they'd already paid for their containers. but we would not accept returned containers once the customers had handled them. So to maintain social distancing in our field, we spray painted the end of every other aisle, either yellow or blue. One day we would instruct customers to pick on a yellow row that no one else was on. And then the next day we would have everybody pick on the blue rows, go down a blue row that nobody else is on. Strawberry rows are 5 foot on center. So this kept everybody out in the field 10 feet apart. So people really appreciated that because they are 10 feet away from anybody that they might not know. And it just made them feel a lot safer. So feedback we got from our customers was that if they'd been to another farm, they felt like they were too close to people they didn't know when they were out in the field. They were too close to people. Everybody was backed up in checkout lines to pay. So they loved being able to go online, pay in advance. They liked the signage we had up around the farm, and they liked the social distance measures that we had put in place. And they said they felt very safe bringing their family here during our season. So we've been in business for 22 years now. It's just hard to believe. But we had so many new customers. I had just never seen them before. But a lot of those new customers became repeat customers. So I'm hopeful they'll all be back next year. We'll see. But truthfully, this was in 22 years, this was the most profitable season we had ever had, even with kind of trying to limit how many people were here at one time. It was our most profitable year we've ever had. So that's it. That's what we did.
Thanks, Kalma. So you know, that was really good. Thank you very much. I have a few questions in the chat box for you. The first question is, has anyone looked at the effect of COVID on CSA operations? That's probably more for Ben, really.
Yeah, I mean, no, not really. That to my knowledge, and similar to what Karma just shared, I know that anecdotally, I've heard from many CSA operations that they've had sales sort of through the roof, especially early on, from a membership standpoint. But from a safety standpoint, it would be, you know, sort of no different than any other food setting. But it sounds like that it was for those who had the infrastructure, it was a very good year, and that those memberships have remained. Not just a short amount of time while we weren't able to get to restaurants or retail stores. But
yeah, that's what I hear too. And another question is from Chuck. What was your charge for the bucket and the quart boxes? Okay,
the bucket was 14, and I don't know why we did that. Next year we'll do 15. It's just easier math. But buckets were 14. And then the quart baskets were 5.
And then the people could keep the bucket, basically.
Right. And you know, a lot of people, they would take their quart. I saw a man put 3 quarts worth of strawberries into 1 quart basket. And I saw him walking to his car, and he had it all very carefully balanced. And he looked over at me, and I just waved, "Bye, see you next time." You know, and I think he thought he was getting by with something, but I just appreciated that they were here.
Yeah, so he asked how many quarts were in the bucket too.
I would say like 3.5 quarts, really. But I put a little bit more strawberries in each of my quart baskets, I think, than some other farms. They're supposed to be, a bucket is supposed to be a 4-quart bucket, but I would say 3.5 quarts in a bucket, truthfully. So. And
then I have a question from the price. You say like $15 per bucket. How much of that is the bucket? It's like $1 or something for the bucket.
Right, the bucket's just under $1, but and that includes the label, because we have We have the label put on the bucket, so it includes the bucket and the cost to have the company put the labels on for us. And so that made the price go up a little bit, but still each bucket was less than $1. So then if they brought their bucket back, on our online store, we had an option where they could actually sign up for a time slot that said, I brought my bucket back, and then that option was $1 less. So they could use that option if they were return customers.
And how much traffic did you get through your online store, really? Because that was the first time you really had that.
Right. I think most of the time, all the buckets and quart basket options we had would get sold. And then sometimes I would look at my daughter and say, maybe we need to add some more. And we kind of look at the field and see how many people were out there. And then maybe we would add some more buckets to a time slot if we felt like we needed to. So it just worked out really well for us. And then, you know, like I say, we had a lot of people that didn't know we had the online store. So we had buckets that we could just sell to people that just walked in as well.
Okay, so another question is, how did you keep folks from eating fruit in the field?
You can't.
Yeah, I was thinking about this. I was like, how would I do that?
Well, you know, we have signs up there, you know, at the stand, cute, funny little signs. And used to when we would weigh the strawberries and people would bring their buckets back up to the stand, and then we would take their bucket from them and weigh it, and we were charging by the pound. Some people would say, oh, it charged me a little extra because my children ate while we were in the field. And I said, well, you know, we understand that, but, you know, we do weigh the dads because we figured if anybody was eating more than anybody else, it was probably the dad actually that was weighing more. So it was just kind of a standing joke. We only weigh the dads if we feel like we need to. So it happens. We don't encourage it, but we know that it happens.
So another question we had was how many pounds per quart of grapes? So usually charge about $10 for a 4-quart bucket or $15 for a 6-quart bucket. That's what I heard this year. And then how big is your strawberry U-pick operation? That's another question we have.
For me?
I don't have one.
Yeah, our field is just under 3 acres. So our pick-your-own field was 56 rows. And so the idea was to have people picking on every other row. So maybe for a time slot, we would sell like 20 buckets, so that we still had 5 rows or 6 rows that a walk-in customer could be on. So.
And then so this is the last question, unless Debbie has something to, Debbie, did you want to say something?
No.
Okay, good. So the way.
Oh. Okay. Yeah. I can't think of anything I was going to say. So.
All right. Well, I have
yeah,
go ahead. I have one more question. Or one more remark, basically. So you were using spray paint to basically say, you know, day one are blue colored lines, and then the next one are the yellow colored lines. I don't know what colors you use. So in a Muscadine operation, that would be very easy to do, because you have, like, you know, you can pick the grape from one side at one day, and then from the other side the other day, and that would add another level of safety in your operation, basically, without too much work, really. So, and did the customers stay in those rows, or did you have a lot of trouble with them, like, not staying in those rows?
Well, at our farm, everybody, I was so amazed. We had like little lines spray painted on the driveway that if people had to wait in line, they would stay on their line, and people would just space themselves 6 feet apart. And out in the field, everybody, oh yeah, I'm supposed to be on a yellow row, and people would like, oh, what color row are we supposed to be on? And you know, one of the kids would tell, oh, we're picking on blue rows today. So people, I think the whole COVID thing was so new, people were glad to have rules to follow.
Mm-hmm.
And they wanted to do the right thing, and they were glad that you had these safety measures in place. And so I think I only had one person out of the whole season that wasn't cooperative, and they just kept taking their quart basket to the car and putting it in their car and going back and filling it up some more. So you know, that's just people. But I think people were glad to see the signs. They were glad we had rules. They were glad that we, you know, were trying to keep them safe. And so they were more than happy to cooperate with everything we were asking them to do.
Okay.
I was just talking to a muscadine grower this morning about what they were planning to do. And we were talking about eating in the field. And, you know, we decided that you tell people not to eat in the field, not so much to keep, you know, to sort of remind them that there could have been somebody else before them who was eating the field, who was handling the grapes that they're touching, so that they realize that they're at risk too. It's not just that they're putting somebody else at risk, but somebody else could be putting them at risk if everybody didn't follow the same rules. And so, you know, one of the benefits of asking people to mask up in the field is it's a lot harder to forget and, you know, slip that grape under your mask than it is to just munch down a few, which is what you would naturally do to begin with. I mean, you know, obviously you're trying to get people to pick on either sides, but the less people are handling other people's grapes, probably the better, you know.
So Mark, with at one of the operations that we worked with, again, COVID is really a person-to-person issue, and it was a larger strawberry farm. They had both U-pick as well as workers on the farm that would pick pre-picked berries, and they had an issue with some of their workers, and that basically knocked out their entire workforce, being in quarantine. And anecdotally, they were able to kind of shift over more to the U-pick. Now, they didn't have customers go into the areas that they had their workers in previously, but parts of the field that they had destined for the pre-pick operation, they just simply moved it over to U-pick. And it was really a great season for them. By making that shift, they said that they had done more business with U-pick and really only saw a small blip kind of overall for losing their workers. There may be a lot of farms that might not have that advantage of being able to make that shift back and forth. But again, it's really a person to person. It's really issues with the folks that you have there on the farm, more so than a foodborne issue.
In terms of encouraging people to get out and pick, you know, the Muscadine Association is working through its Facebook page to encourage people, to tell people when the season starts. So those of you who have farms and are doing pick your own, you know, let us know, send us a picture, we'll promote it. You know, like, look, you know, our farm is open now. Here's a picture. People are really happy. And we will, you know, pick your own is definitely on the up. And, you know, we can also emphasize how safe you're being about what you're doing. So we can enhance what your efforts are through our own social media here at the association.
All right. So I think we answered all the questions. There will be no pesticide credits today here. I know somebody put the number in there, but we will not have any pesticide credits today.
And Mark, you're going to record this and you'll post it and we'll post it, right?
Yes, it's all recorded. It will be on our Grape portal latest by tomorrow morning with the presentations available, and then you post it on your homepage as well. Okay, so I thank everybody for your time. We run a little bit over, but thanks for everybody staying on, and I appreciate it, and I hope you have all a nice evening.
Thanks, Mark.
Thanks for having us, Mark.
Thanks, Ben. Thanks, Chip.
Thank you.
Bye-bye, all.